basic humane aspects of our business are lacking.
Are we really investing in the capacity building of the people?
One gap I see in supply chains generally is the need to professionalize the industry.
We should consider health supply chain, which is male dominated. We should encourage more women to get into that space.
I really do think it comes down to looking first at what are the decisions and actions that supply chain managers, health managers need to make routinely, daily, weekly, monthly, and what are the ones they cannot be effective, whether it's an action or a decision. Like, are there actions and decisions they should be taking that they're not? And is it because they lack the information to be able to do that? Or is it that the process isn't there? Or is it that it's not a priority for them because they may be so overwhelmed with other responsibilities?
Talking about optimization of our supply chain means thinking about trainings, thinking about digitalization, thinking about procedures, and thinking about people. Do we have the culture embedded within our staff inside different institutions about supply chain resilience? Do we have clear SOPs, clear operation procedures? So these are the kind of questions that we need to ask ourselves as an institution and as individuals.
It's just having the supply chain well defined, well documented, such that systems don't change with people. You know, you have a system that whoever comes in fits into a system that is already robust.
We need to build partnerships with the private sector and leverage the expertise.
The same places to look for what we required. And once those countries closed down, we saw how it affected the supply chain, how we were not able to get what we needed when we needed. And that also trickled down to the logistics part of it, how are goods going to get from where they are to where we need them. Number two was the regulatory frameworks. So we saw governments practicing protectionism. So they're ring fencing.
There isn't enough donor funding out there to reach everybody to the level of their expectation. So let us focus more on eliminating waste. Look at the value chains. Let us be very, very intentional about creating that level of efficiency that will impact the patient outcome.
I think it would be brilliant if we had better visibility over stock positions so that we could share those resources more broadly, avoiding unnecessary drugs going to waste through expiry or avoiding ruptures, which can also obviously have a really negative impact on the beneficiary at the end of the day.
Supply chain is not like any normal supply chain. It's not a matter of handling boxes. No, you need people of expertise. And this is another area that we really need to improve and work on.
We are so focused on transforming the health sector in terms of deliver the goods in time, make sure that you're procuring the right products, make sure the specifications are correct, make sure that you're reducing the cost of operations. We forget the humane side of it. So that's an element that I would add to the supply chain, or logistics operations.
In many health systems, you have very committed superheroes, clinical officers, nurses, pharmacists, all of whom join the health system. But they join because they have a passion to save lives, to treat people. They don't join because they're interested in making the supply chain work. There's opportunities for introducing supply chain as a professional cadre within health systems. These professionals are the ones that are going to help us be resilient, be agile when the next pandemic hits. But they're also the ones that are going to be motivated to do the daily tasks that need to happen for a supply chain to run effectively.
Women leadership is key. Women understand the need for a woman not to die. Women understand the need for children to have access to medicine. So for me, we should consider health supply chain, which is male dominated. We should encourage more women to get into that space. Then in Nigeria, we make health a priority and begin to ensure that not on my watch will there be women dying and children dying. Thank you.